Respiratory distress syndrome and macrosomia in a mother having diabetes, the type 1 diabetes. We continue with the same patient in the video uploaded just now, diabetic ketoacidosis. We talked about a 14 years old girl came with diabetic ketoacidosis, effectively managed. She got married 3 years back, and again she comes with pregnancy to the obstetrician. Let us get meaning of these out of these terms first. Macrosomia, body weight greater than average. This much is the normal average weight. So more than this becomes macrosomia. Respiratory distress syndrome. It's a condition where the newborn is having breathing problems, cyanosis, and the condition is worsening in her case. So we talk about this patient. So now she's 26 years old, as we discussed, diagnosed with diabetes type 1, 13 years of age. And we also talked about a lot of acceptability, which is very common because at such a young age, it's very difficult to follow all the do's and do nots, so many dietary and other restrictions. But now, 1 year after marriage, she went for a trauma, abortion, and this time when she came to the obstetrician, the physician was also consulted, and he told her husband value of meticulous control of diabetes. She was told that if control is not kept, the child may develop congenital abnormalities. फर्स्ट ट्राइमेस्टर के अंदर उसका रिस्क सबसे ज्यादा होता है. But fortunately for her, ultrasonography showed that no congenital abnormality has taken place with her meticulous control, which she tried to do. But then later on, the BP, blood pressure started rising later on in the pregnancy after 28th week, and the ophthalmologist reported retinopathy was progressing fast, and HbA1c, the indicator of long term of diabetes, that was also raised to 7.3%. So all these events decided that cesarean section should be performed. Moreover, the fetus was developing, as the obstetrician reported, some distress the fetus was, he reported. So premature termination was decided by all of them. First of all, we are going to see some basics about it. We talked about macrosomia and respiratory distress. First, macrosomia. Why the child is large size? Why the fetus, the newborn, will be large size? Because of simple statement, I can summarize. Glucose can cross transplacental barrier. Very easily it can cross. But insulin cannot cross. A simple statement. So अगर maternal hyperglycemia है, glucose will be transported, facilitated transfusion with the help of, glut transporters. GLUT3, we are going to talk about it. So glucose will be going into the fetal circulation. And so fetal hyperglycemia ho jayega. Now you people know that the best sensor of blood glucose level are beta cells, beta pancreatic cell. So fetus ke beta cell, they will sense hyperglycemia and release insulin in response. This is called glucose-induced insulin response. So we summarize hyperglycemia in mother, as it is happening now, reflected by high HbA1c, will be accompanied by, will lead to hyperglycemia in the fetal circulation. Because of these GLUT3 transporters, glucose will be transported. And then glucose will be stimulating beta cell, resulting in hyperinsulinemia. So the sum and substance of everything is that hyperglycemia, maternal hyperglycemia, ultimately resulting in hyperinsulinemia in fetus also. So what are the problems in fetus now? Hyperinsulinemia, high insulin level and high blood glucose level. Right. Now, you people know that insulin is a very potent anabolic hormone. Insulin, most importantly, promoting entry of amino acids into the cells, and after that, translation into proteins. Okay, synthesis of protein. So the protein synthesis will rise. A most important anabolic effect, cholesterologenesis will increase, lipogenesis will increase, glycogenesis will increase, TAG synthesis will increase, as you can see by the all these green signals. So insulin is promoting all anabolic activities. Most important, I would say, is that of proteins. So there is no wonder that the baby will be, the fetus, developing fetus will be large size because of hyperinsulinemia and predominant anabolic effect of insulin. The fetus will be large in size. So this slide you can omit, but it shows which enzymes actually, glycogenesis कौन से enzymes हैं, glycogen synthase, lipogenesis, cholesterologenesis, and most important, increase in the protein synthesis. It's written, yeah, insulin increases the protein synthesis also. All right. So the complications after delivery, hypoglycemia and respiratory distress. Respiratory distress is most important for you people, for the ones who are obsessed with examinations, etc. Because it is frequently asked, although I don't give much importance to that. You're going to be doctors, not to pass the exam, you are studying all this. That's what I feel. Hypoglycemia क्यों होगा? Because fetus के अंदर पहली बात तो brain body weight ratio is high in the infants, and as you know, so that increases demand for glucose. Second, hepatic glycogenolysis, that is fetal hypoglycemia. Uh, just let me put it in another way. As we saw that insulin level is high, let me go back to this slide. Insulin level is high in the infant. After delivery, this supply of glucose, placenta removal, now glucose will be quickly utilized. So now insulin level is high, but constant supply of glucose is not there. So what this insulin will do, it will decrease the blood glucose level. So it will decrease the blood glucose level, hyperinsulinemia, because hyperglycemia does not persist, but hyperinsulinemia persists. Why hyperglycemia does not persist? Because the constant supply from maternal circulation is stopped now. So going back to this slide, so the first point is this hyperinsulinemia. Second, infants are more prone because brain body weight ratio is high and hepatic glycogenolysis cannot compensate for this because of immature system. इतनी fast नहीं हो पाएगा. So the blood glucose level will show precipitate fall. So now respiratory distress हम करेंगे, but one question for you people. Respiratory distress इस child में क्यों होगा? We are going to talk about it. Respiratory distress syndrome, just to build up some background, this is deficiency of lung surfactants in preterm infants. Recall, the child was delivered prematurely at 32nd week of gestation. 15 to 20% mortality and morbidity in the Western world is caused by this disease, this condition, respiratory distress syndrome. No data for in India is available. but that reflects magnitude of the problem. So lung surfactant, they start getting secreted at 30th week of generation and they peak at about 34. तो अगर आप प्री टर्म कर दिया तो उसमें ये प्रॉब्लम हो सकती है. So antenatal history of the mother we have already discussed. Now postnatal period. 32nd week of gestation per delivered premature because of we saw various indication. Most important, fetus distress was detected, macrosomia was detected, maternal complications were aggravating. After delivery, the neonatologist has to be on guard. His role is most important after delivery. First हमने देखा था, he has to be prepared with the blood glucose dip. He has to anticipate that precipitate hypoglycemia may occur. Fortunately, nothing of that type happened in this child. Increased respiratory rate. Nothing happened because glucose dip was given. So the newborn had increased respiratory rate, tachypnea, stomach, and cyanosis. X-ray chest performed later on found ground glass appearance. The condition was worsening. The child was put on oxygen. Now we are going to see basics of this. Why does that happen? As we saw this statement, that deficiency of lung surfactant in premature infants. So, ये क्या होते हैं lung surfactants? The most important component of lung surfactant is this phospholipid called dipalmitoyl lecithin. It is glycerol backbone होती है, 3-carbon glycerol backbone, first and second position पर palmitic acid, the C16 saturated fatty acid is esterified. At the third position is a phosphate and a base. Base is choline. So two fatty acids, dipalmitoyl and a phosphoryl base at the third position. So it reduces surface tension of the thin fluid film that lines the alveolar wall. So you people know about your physics, surface tension reduce ho gaya. So it prevents collapse of the alveoli. And conversely, in the absence or deficiency of this most important component of lung surfactant, the alveoli will collapse and immediately life-threatening respiratory impairment will occur. So pulmonary surfactant, something more about it also. Most important, we have discussed this one. Sphingomyelins are also there, although they do not play any significant role in reducing surface tension. Some proteins and some cholesterol, etc. are also there. So here I have shown first and second position per palmitic acid, third position per phosphate, a phosphoryl base. So this is phosphatidylcholine, a phospholipid. Most important function of phospholipid is membrane component, but this is also a very important role. So I hope the fundamental concept I have tried to clear, that reducing the surface tension and preventing collapse of the lungs. So that's a very, very serious condition in the infants. So immediate treatment is required, otherwise immediate death will take place. And you have followed this patient right from the beginning. What a great turmoil it's a very patient had to undergo. और delivery के बाद अगर fetal death हो जाए, how catastrophic that can be. So the role of neonatologist is very important, twofold, preventing hypoglycemia, and second, to avert any consequences related to this. Now, just to completion sake, I talked about sphingomyelin also. So lecithin, the dipalmitoyl lecithin sphingomyelin ratio reflects fetal maturity. It is low before 30 to 32nd week of gestation and rises after that. In fact, lung surfactants, they start rising, dipalmitoyl lecithin also, after this 32nd week of gestation. तो हमने इस बच्चे में पहले ही कर दिया था, fetal maturity, lung maturity भी नहीं थी, तो ratio above 2 means sufficient lung surfactants are present and they rise after 30 to 34 weeks, which was not done in this child क्योंकि टाइम नहीं था ना फीटल मेच्योरिटी का. तो दिस इज जस्ट फॉर कंप्लीशन से. उसके अंदर डाइपाल्मेटॉयल लेसिथिन में क्या था? ग्लिसरॉल बैकबोन वाज देयर. हियर इट इज 18 कार्बन स्फिंगोसिन बैकबोन इज देयर. स्फिंगोसिन एंड एमाइनो अल्कोहल, एक फैटी एसिड होता है उसके साथ, फैटी एसिड हियर, and phosphoryl base is also there. This is also an important phospholipid. So this is all we talked about. Tachypnea, why that will be there? Cyanosis, intercostal and lung recession that can occur after alveolar collapse. So this question I am leaving you. Why there is cyanosis? Of course, this is the hint for you people. Collapsed lung, decreased lung compliance, or hypercarbexia, hypoxemia. These two are, in those cases, which are fortunately averted in this child. But if the child you have to shift to the nursery, then that time all these investigations, all this has to be borne in mind. And what is the treatment? Mask and cannula for delivering oxygen. CPAP, this is the full form. It gently pushes oxygen and keeps the airway open. Fortunately, it was not required in this child, and in more severe cases, ventilator, and then exogenous surfactants are administered by inhaler. I must say a word of thanks to Dr. Vivek Ranjan, an obstetrician, my friend. He told me that pharmacological support for mother, it is also possibility. But it is done 30 to 34th week of gestation, which of course was not possible in this child. High dose of beta-methasone acetate. These crosses indicate what he told me. It is not available in India. With a difficulty, you can make it available. So dexamethasone phosphate, 24 milligram in divided doses, etc., etc. But an important point what he told me was that after you give it to the mother, within 1 week, you have to carry out the delivery. You have to deliver the child. So we finish with that. The key points: uncontrolled diabetes in mother results in large size infants, macrosomia. The reason: insulin cannot cross the transplacental barrier. Insulin cannot cross, whereas glucose can cross. So hyperglycemia in fetus results in enhanced glucose-induced insulin response, resulting in hyperinsulinemia. And anabolic effects of insulin result in macrosomia. So life-threatening complications after delivery are hypoglycemia and respiratory distress. And then about the key points about respiratory distress syndrome. We had talked about क्या थे key points उसके अंदर? The key points थे dipalmitoyl lecithin. It is most important component of the lung surfactant, and lung surfactant they keep alveoli intact. तो अगर इनकी synthesis कम हो गई dipalmitoyl lecithin, the lung collapse will be there, and that will result in lots of those complication, fetal respiratory distress syndrome. So everything went on well. Fortunately for this patient, let me tell you, this is one of the real cases I came across when I was your age or slightly older. I was an intern that time. So everything was successfully done. And I met that child a few months back also. He is now responsible, in and hearty, and everything is well. So thanks a lot. Thanks, Dr. Adelbert, and thanks, Dr. Vivek Ranjan also.